There was legend told of a veterinary professor who wanted to know what it felt like. This may just be a legend of the Western College of Veterinary Medicine, but infested themselves with ear mites to see if they could feel them, and reported that it was the most uncomfortable and psychosis-inducing event that they've ever had, but easily treated with parasiticides. I will not be putting those swabs in my ears.
Please don't.
This is Chad. He is a 16-week-old ragdoll kitten. He came in for his rabies vaccination, and I noticed that he had some pretty goopy ears. So you can see we've got the majority of it out right now, but we took a look under the microscope and we diagnosed an ear mite infestation. Little kittens are prone to getting ear mites. We typically see it more often in like farm kittens. So now we're just gonna clean out all of the gunk, and then after that he's gonna get some medication to kill those ear mites and get all that goop out. It's pretty irritating to have ear mites. They're crawling around in the ear canal. They're blood feeding, so that's why we have all of this dark material here. So that's essentially blood and dead mites. On the microscope we saw a bunch of live mites and also a bunch of dead mites in there. So usually with 1 to 2 treatments we can get these sorted pretty easily.
We started off the morning looking at a dog that had recently been diagnosed with diabetes mellitus and had started on treatment about 6 weeks ago.
Just pulling blood work, looking for dehydration, looking for changes in the white blood cells to see if there's infection, looking to see if he's anemic or low blood components. Then also we'll run chemistry, looking at all of his electrolytes and his kidney levels and his liver values. Just try to draw together a better clinical picture of what's sick and what we can fix. And then also important to do blood work because he has a history of diabetes. It can be a comorbidity for other things as well, so we've got to make sure that his kidneys are great and liver's great. Doesn't have an infection.
Unfortunately, the blood work was showing that the pet was in a state of diabetic ketoacidosis. So this is essentially when the body is instead using ketones as fuel instead of our normal glucose, and this can be a pretty deathly thing. So the pet is diabetic, unable to release insulin to get glucose into the cells that is usable, so it ends up using ketones instead, and this can be a very deathly disease once they're in a diabetic ketoacidosis that needs to be taken very seriously and treated very aggressively. So the pet has been hospitalized now, and Dr. Renee has him on some specific treatments to help with that. While this was going on, I was busy working on Halo.
This is a very old boy that has some lumps. The issue with the lumps is that they're breaking open and bleeding, so it's just more of an inconvenience to the owner. They look like papillomas, so I'm not entirely worried about them being something malignant or spreading. Ideally, it's always great to send it away, but owners are more focused on just getting them off, so we're just taking them off. So we won't have information about what they will be, but at least they're gone. Like we were seeing these in a young dog, we'd really want to send them away because obviously like it could influence the rest of their life, but this dog it might not.
We removed quite a few lumps off of him, and then we also took some x-rays to look at the arthritis that was suspected. So Halo has been diagnosed with arthritis quite a long time ago at a different veterinarian, and we were really looking to ensure that it was actually arthritis and not an osteosarcoma or like a type of cancer that's in the bone. Even when you move this joint, it's crunchy, so all of these little tiny bones in here are all fusing together. So that's definitely painful As we were doing this, we took lots of different radiographs. We could see that there was arthritis in quite a few different joints. What surprised me the most is the hips looked pretty phenomenal, and I expected them to not be great. I definitely suspect there is quite a bit of inflammation in the spinal cord, and this is probably what's causing the ataxia or incoordination or proprioceptive defects in his hind legs. However, without an MRI or a CT scan, we wouldn't be able to confirm this 100%.
Then we took a better abdominal view, and you can see there's just this mass, something in there that's not normal. So I suspect there is a splenic mass. At this point, you know, we can't tell the owner whether it's malignant or benign or if it's anything to be concerned about. So if the owner wants to go forward with surgery, great, we'll do that. If the owner doesn't want to, then it's going to be monitoring for lethargy, anorexia, collapse, and potential, like this can spread if it is malignant. I'm doing an ultrasound because it looks like there's a mass on his x-ray. So I'm gonna see if I need to go this way. So I'm gonna see if I can see it. So this is spleen here. And then when I fan over, this is all mass. So it's probably attached to the spleen. Which isn't why the dog's here today. But it's just a definitely incidental finding, and we'll talk to the owners that it's there, and if they want to remove. Old labs, spleen is probably like one of the most common places we'll see tumors.
From here, we need to chat to the owner about surgical removal or monitoring clinical signs as the mass progresses. So while I was doing this, Dr. Courtney and our student and were looking at another case.
So it's on her back right upper thigh. Honestly, it's probably just a bruise, but we found it on Saturday.
And she's eating and drinking and
Yes.
normally no vomiting, diarrhea. And she was vaccinated in this leg not too long ago, correct?
Probably. Yeah, she was one in each thigh.
Okay. Yeah, so I do think it is most likely a vaccine reaction. Just
You do? Like even after, because we didn't notice it until Saturday.
Right.
So you think it just came up later?
Yeah, it's definitely possible.
Okay.
I would just keep an eye on it, I think, and if it grows, then we should definitely do a sampling of it, like an FNA. But if it doesn't grow, I wouldn't worry.
Okay, I was just a little bit worried.
Absolutely, and if you notice that, like I said, it's growing, it's causing her any pain, she's increasingly lethargic, not eating, drinking, vomiting, diarrhea, any of that,
Okay.
or any other lumps pop up, definitely bring her back, absolutely.
And then finally, we looked at Jeeves, an 11-year-old cat that is having some issues eating his hard food. He doesn't like to chew it and likes to just swallow it instead. He will eat wet food, no problem.
Look at this freaking majestic. He's like Aslan. There. Up until 2 weeks ago, we were using a bovine rectal probe to do cysto, so I've gotten very good with that. We're just gonna start running the blood and the urine.
On our exam, we could see that there is a moderate amount of gingivitis and quite a bit of dental calculus that is built up on the molars in the cat's mouth. I couldn't see any specific resorptive lesions, but he definitely was uncomfortable when we were feeling those areas. So we ran some blood work, a full panel, looking at his kidneys, liver, immune system, electrolytes, thyroid, just to get a better idea of what everything is happening on the inside. And then we're gonna schedule a dental in the future to remove any teeth that might need to be removed and do a full dental cleaning.